Okay, so first thing, I would grab all of my equipment, clean my equipment off, check that he actually needs an assessment, knock on the door. Knock, knock, knock. Hand hygiene. Hi, my name is Alexis. I'm going to be doing your physical assessment today. I'm an LCC nursing student. Can I get your name and date of birth?
McPreston, 10/26/92.
Awesome. And what brings you in today?
I got this weird shoulder pain.
Okay, so pain in your shoulder. And when did that start?
Last night.
Okay, and can you tell me what it feels like?
It's just kind of like when I move it really far up and things, it hurts real bad. Like I can barely lift it up sometimes. It's driving me nuts.
Okay, and is it radiating?
No, it doesn't radiate.
Okay, and is it associated with anything like elbow pain, wrist pain?
No.
Okay.
No.
And is it worse in the morning or in the evening?
It's pretty consistent all the way around.
Okay. Anything make it better or worse?
Trying to lift it really kind of above that area really hurts. Trying to bring it in sometimes hurts, but really just moving it is what makes it bad. I can ice it and stuff, and sometimes that helps a little.
Okay. And then out of 1 to 10, 1 being no pain, 10 being worst pain ever.
Like a 4 right now, and then like a 10. So that's, yeah.
A 4 and a 10?
The 4 when I'm not moving it, and 10 when I try and lift it up.
Okay, so I did his pain scale. When I came in, I did I did like a general survey in my head. So general survey would be young adult male, clean, well-groomed, speech is clear, no signs of cognitive deficits. Yeah. Okay, so pain is done, so I'm going to start with a neuro exam. And can you tell me your name one more time?
McPreston.
And where we are?
We are at the hospital.
Yeah, okay, we're at the hospital. And do you know what day of the week it is?
It is Monday.
Yep, it's Monday. Yep, okay. So then I'm going to check his pupils. I'm going to check size first. About 4 millimeters. And I'm going to check for pupil response. Just look at my nose, man. Alright, pupils are pearl. And then from that, I'm just going to move into eyes, ears, nose, throat. So because I'm already up at his eyes, go ahead and pull your eyes down for me. Awesome. Conjunctiva is pink and moist, and sclera is white. And I'm going to check in his ears. Other side. Awesome. Mild strumen present. And go ahead and tilt your head up for me so I can look in your nose. Great. And open your mouth for me. Say ah. Awesome. And can you pull your lips down and up? Great. Mucous membranes of the nose and mouth are pink with no lesions present. There's no broken teeth and no dentures. Okay, so I'm going to move into cardiac. I'm going to feel for his carotid pulses first, one at a time. Okay, carotid pulses are +2 out of +3 bilaterally. And then I'm going to move into cardiac. First, I'm going to find the aortic listening site, which is on the right sternal border, second intercostal space down. So... Okay, and then I'm going to correlate it to his carotid pulse. Okay, S1 is correlated to carotid pulse. And then I'm going to take his heart rate. Okay, heart rate is 66. S2 is louder than S1, and I hear no murmurs, rubs, or splits. And then I'm going to listen to pulmonic listening site, which is on the left sternal border, second intercostal space. So I'm just going to move right over. Okay, heart rate is approximately 66. S2 is louder than S1, and I hear no murmurs, rubs, or splits. I'm going to move to the herbs site, which is going to be one more intercostal space down, so third intercostal space on the left side. Okay, heart rate is approximately 66. S1 and S2 are equal. I hear no murmurs or rubs. And then I'm going to move to the tricuspid listening site, which is going to be fifth intercostal space down on the left. Okay, heart rate is about 66. S1 is louder than S2, and I hear no murmurs or rubs. And then mitral valve site, I'm going to move to the mitral valve site, which is midclavicular line on the left, fifth intercostal space. Okay, S1 is louder than S2, heart rate is approximately 60, and I hear no murmurs, rubs, or gallops. And then I'm going to repeat the whole thing with the bell. Okay, no abnormal sounds heard with the bell. I'm going to switch back to using my diaphragm and have him roll on his left side. And no abnormal sounds heard while he's lying left lateral. Okay, so cardiac's done. I'm going to move to respiratory system. I'm going to have him sit up on the edge of the bed. Thank you. First thing, I'm going to take his respirations, but I'm going to be palpating his radial pulse so that he thinks I'm taking his pulse. But now he knows I'm taking his respirations, so they're probably not going to be right. Are you holding your breath? Okay. Okay, so respirations are about 12. They are effortless, symmetrical, and go ahead and take one more deep breath for me. Okay, and they are without lag. All right, so I'm going to have you, can you turn and face that way? And I'm going to go from his back. So as he turned, A and P ratio was 1 to 2. And then I'm going to lift up your shirt, okay? So skin on the shoulders, shoulder blades, and ribs all intact. And I'm going to listen. Take a deep breath for me. And again. Okay, so now I'm going to listen lateral, 2 on his left and 3 on his right. Go ahead and lift this arm up for me. One more. Awesome. And then the other side. Slipping. Awesome. And then you can turn around and face the front and I will listen to his chest. Deep breath for me. Awesome. So lung sounds are clear through all. And then I'm going to do upper extremities. And I'm going to start with blood pressure. Oh, which means I'm like this. Is it okay if I use this arm? No
Yes.
fistulas, implants, no injuries on this arm?
No.
Cool. In order to pick the right cup, I have to do the 40-80 rule. So I'll go ahead and do that now. Check the bladder size. That has to be 40%. And the bladder goes to here. That has to be 80%, which it is. Hey, thanks. So first thing, because I'm doing the 2-step method, is I gotta find his radial pulse. Got it. I'm gonna blow up until I don't feel that anymore. Which is about 120. So I'm gonna go 30 past that, so I'll go to 150. I'll give him like 30 seconds. Okay, that was 30 seconds. Okay, so we're gonna go to all the way up to 150 and then let it come down and listening for those. About 122 or 78, which is within normal. Okay, so I'm going to look at his upper extremities here. I'm going to feel with the back of my hand all the way down his arm. Skin is warm, dry, and tan with pink undertones. I'm going to take a look at his skin, his elbows. So if I can look at those elbows, and then your wrists. Okay, and there's no skin breakdown on the elbows or the wrists. I'm going to take a look at his nails. Capillary fill, about 1 second, 1.5 seconds, and there's no clubbing on the nails. Okay, and then strength. So I'm going to have you squeeze. Okay, grip strength 5 out of 5. Go ahead and pull toward you. And me. Awesome. Extremity strength +5 out of +5. Then I'm going to do pulses. Brachio first. +2 out of +3 bilaterally. Radial pulses. +2 out of +3 bilaterally. Laterally, ulnar pulses. Hi, kitty. +2 out of +3 bilaterally. Okay, so that's it for upper extremities. So now I'm going to move to his abdomen. Go ahead and lay that down for me. Okay. Okay, so I just remembered I forgot JVD, so I'm going to go back to that. So I would adjust the bed to 30 to 45 degrees. Yep. And then I would shine a light, make sure I'm not seeing that shadow on both sides. Okay, patient's negative for JVD. Awesome. All right. So moving on to the abdomen, I would walk around the bed, look at the abdomen from the foot of the bed at bed level. Abdomen is flat and non-distended, symmetrical. Yep, so then I would take a listen. Starting in the right lower quadrant. Okay, bowel sounds are active in all 4 quadrants, and then I would do light palpation. Let me know if any of this hurts. Okay, abdomen is non-painful upon palpation. Okay, so then I would move to his lower extremities. So same concept, I'm going to feel with the back of my hands. Skin is warm, dry, tan with pink undertones, and lateral sides of the knees and ankles, the skin is intact, no breakdown at all. Check for edema, so I'm going to push and pull, and there's no edema, so negative for edema. Capillary refill is 2 seconds, well, 1.5 seconds, and then the 3 pulses. So I'm going to do femoral first. So go ahead and bend this knee. Thank you. This one, right? Okay. Oh, look.
Sorry, I'm tickled.
+2 out of +3 bilaterally. And then I'm going to feel for pulses on the top of the foot, dorsalis pedis. +2 out of +3 bilaterally. And then the lateral tibialis. +2 out of +3 bilaterally. Okay, and then sensation. So I'm going to grab my cotton ball. Okay, close your eyes. Let me know when you feel my cotton ball.
Yes. 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 Yes.
Okay. Lower extremity sensation is intact. And then I would have him sit up. Okay, and go ahead and stand up for me. And posture is really tall. No, erect. Posture is erect and balanced. And then I would have him walk away from me. And then towards me. Okay, and gait is steady, even, and coordinated. Okay, and I think that's it.
All right.
All done. Yay!
Hey!